we had records set for the whole history of the company in urgent care. So this is very, very worrisome.
A record-setting day for COVID cases, but not just at one medical clinic. We're talking several. And what about those vaccine deadlines for hospital employees? They were pushed back because of crisis standards of care, but that has come and gone. Are those rules back in place, and do they apply to traveling nurses? What was once a bustling stable for Boise's now defunct horse racing industry will soon be no more. What Ada County commissioners have in mind for Expo Idaho.
And yesterday was the highest test volume day you've ever had.
Highest visit rate to urgent care, highest test volume, and highest number of positive people.
That's an ominous sign from Omicron, but if there's a bright spot, increasing case counts aren't exactly translating to major increases in COVID hospitalizations. It's not as heavy hitting as Delta, we're told, but it spreads faster. It's more contagious. The bad news, though, you just heard it, an increase in visits to urgent care clinics across the region. More than 2,000 visits to primary health alone yesterday. Dr. David Peterman, the CEO of Primary Health, and a familiar face here on the 2-8, says they are seeing numbers they didn't see when we were back in crisis standards of care last year. He says right now they're seeing positivity rates of 30%, adding that this is a worse wave than they saw with Delta. But one of the bigger problems, he says, more and more staff calling out sick. Primary Health employs about 600 people. On Sunday, 36 of those called out sick. On Monday, 38. Yesterday, 50. And today, we just learned 65 of their employees are home recovering, isolating.
Normally, the wintertime, we do see an increase, but it's half. This is double. We're approaching over 10% of our employees. The challenge, and I just have to be honest, is people have to wait to be tested. I mean, with 21 clinics and everyone working as hard as they can, but with 50 people out, when we're trying to service everyone as quick as we can. And I don't want to discourage people from coming to primary health, but it's very possible you may wait.
Dr. Peterman says they have a 97% vaccination compliance with their employees. So yes, they're vaccinated and they're still getting sick. To be clear, we're also smack dab in the middle of flu season, and people still need places like urgent care for things like, sprained ankles and earaches. Dr. Peterman says their clinics are now going to close an hour earlier than usual at 7 o'clock to give employees time to get through other tasks so they can still get home at a decent time. But he says if this trend continues the way it is now, they may have to start closing clinics. Not early for the day, but closed for the day. Right now, Dr. Peterman says despite the wait to get tested, their turnaround time for a PCR test, about 48 hours, so that's good. And you get those results texted directly to your phone. Primary Health isn't an anomaly. According to their online COVID dashboard, St. Luke's saw their highest COVID testing day ever on Monday, nearly 2,300 COVID tests total. It was across all of their locations. And there's still about 200 tests still need to be processed, but as of right now, Monday's positivity rate that is, sits at just over 18% within the St. Luke system. We want that to be around 5%, remember? So not so great. Yesterday was their second highest with just over 1,900 tests. St. Alphonsus, a bit of a different story. While they are seeing an increase in the need for COVID testing, they actually hit their peak back on September 7th. More than 1,000 tests administered that day. Then on Monday of this week, only about 730. Still a big number. We also reached out to Boise State to see what their testing looks like, but we have yet to hear back from them. And if you were hoping to get your hands on a free at-home COVID test, well, the Idaho Department of Health and Welfare says you are out of luck. Those tests that they have been distributing, when you punch in 211, they've all been distributed. So if you are in need of one, they tell you to check your local pharmacy. You can look online or just head to a testing center.